Left ventricular outflow tract view. During standard obstetrical ultrasound evaluation, several views are used to image desired cardiac anatomy. The 4-chamber view is obtained during every standard examination. If technically feasible, a left ventricular outflow tract view and a right ventricular outflow tract view are also obtained. The left ventricular outflow tract view is described here. This drawing shows a fetal chest and heart. The left ventricular outflow tract view is an axial or transverse image through the fetal thorax above the diaphragm. It is used in concert with the right outflow tract view to aid detection of anomalies not seen in the 4-chamber view. Outflow tract views show the left ventricle giving rise to the aorta and the right ventricle giving rise to the pulmonary artery, show normal orientation, that is, perpendicular crossing of the two outflow tracts, and show comparably sized aorta and pulmonary artery. The left ventricular outflow tract view and the 4-chamber view contain several of the same components. For example, the right ventricle, the left ventricle, and their interventricular septum are seen in both views. In addition, the left atrium and the mitral valve are visible. Lastly, the descending aorta can be identified. Importantly, in addition, the left ventricular outflow tract view demonstrates that the ascending aorta arises entirely from the left ventricle. As such, the continuity of the interventricular septum with the anterior wall of the aorta and the continuity of the mitral valve with the posterior wall of the aorta are seen in the left ventricular outflow tract view. The aortic valve is also visible in this view. Here are normal and abnormal examples. With a normal left ventricular outflow tract, the continuity of the interventricular septum and the aorta can be seen. With ventricular septal defect, this continuity is broken and a clear defect is identified. Again here, the left image depicts a normal left ventricular outflow tract, with the left ventricle normally giving rise to the ascending aorta. In the right image, there is a ventricular septal defect. In addition, the aorta is straddling or overlying the interventricular septum and is receiving flow from the right ventricle as well as the left ventricle, as shown here. This fetus has tetralogy of Fallot.